Let's make sure that we are live. Yes, we do. So let's start this event. Excellencies, dear delegates, dear colleagues, welcome to a new session of a series of events co-organized by the United Nations Environment Programme in cooperation with the World Health Organization and the key partners, including the Geneva Environment Network, aiming to raise awareness and share best practices, challenges and opportunities to address pharmaceuticals release into the environment. The series was launched at the last meetings of the Conference of the Parties to the Basel, Rotterdam and Stockholm conventions, which was this spring. Today we are discussing pharmaceutical residues in wastewater, addressing challenges at the end of the pipe. And as we start, we also want to pay tribute or pay homage to Caterina de Albuquerque, who served as the first special rapporteur on the human rights to safe drinking water and sanitation. She was an award-winning lawyer who was the chief executive officer of the Sanitation and Water for All Fund. And she sadly passed away this week. Today's session will be moderated by Nana Hanna here on my right, who is a pharmaceutical and antimicrobial resistance expert within the chemicals and health branch of the United Nations Environment Programme. And before I give her the floor, I would like to share some housekeeping rules. Let me remind you that the documents presented, the summary, as well as the video of the event will be made available as usual on the webpage of the event, and you have the link on all the slides that you have on the screen. I also want to add that the transcript is available in over 100 languages, and there are slides now passing explaining you how you can access it. You are invited also to post questions in the Q&A box tool, and we'll use them to feed the discussion if time allows. There will be also some tools, and Nada will explain you this later. So you will indeed in these tools have some questions appearing on the screen to make the session more interactive. So we look forward to have you engaging in this. So with that, Ms. Hanna, over to you.
Thank you, Diana. Good morning, good afternoon to all of you joining us from different parts of the world. It's my pleasure to welcome you to this high-level webinar, Pharmaceutical Residue in Wastewater, Addressing Challenges at the End of Pipe. We are very glad to have such diverse audience with us today, representatives from academia, the health and agriculture sector, environmental agencies, all working at all critical intersection of health, environment, and sustainable development. Pharmaceuticals play a vital role in protecting human and animal health and supporting food production. Yet their unintended release into the environment, whether during manufacturing, use, or disposal, poses emerging risk for ecosystem and human health. Wastewater has been identified as one of the main pathways for this residue, making this topic particularly urgent as we strive to strengthen our understanding and collective response. Our objective today is to raise awareness and exchange practical strategies for the monitoring, prevention, and treatment of wastewater containing pharmaceutical residue from key sectors: healthcare, agriculture, industry, and household. With that, let's begin our program. It's my pleasure to introduce our two keynote speakers who will set the stage for today's discussion. First, we'll hear from Gaston, pharmaceutical lifecycle expert at UNEP. He will provide an overview of pharmaceutical lifecycle and how release into the environment, particularly through wastewater, occur at different stages, highlighting critical intervention points. Gaston, over to you.
Thank you, Nada, for introducing me. Thank you, colleagues, for sharing with us this webinar today. So I just want to highlight some aspects on pharmaceutical life cycle, the role of wastewater on the release of pharmaceutical residues into environment. So as Nada said, please next slide. As Nada said, we need pharmaceuticals for our daily life to produce our food, to take care of our health and animal health. But in the last years, there was an increase in the concern of the presence of these chemicals in the environment. So here you can see, for example, a simple graphic that shows the increase in the number of publications and scientific publications on pharmaceutical monitoring in the environment. So you can see how it looks. And so also it shows that there are more reports in the environment of the presence of pharmaceuticals, both in water, aquatic system or terrestrial ones. So it's not only on the presence of pharmaceuticals, please next, but it also includes some possible impacts of pharmaceuticals in the environment. There is a well-known case, for example, in India, of direct toxicity of diclofenac on vultures, and it led to a decrease in the population of vultures there. And it's not only an impact on the population, but also it has socioeconomic consequences. Also, we have other type of effects, not direct lethal effects, but also sublethal effects, for example, behavioral ones, or endocrine disruptions that, for example, in aquatic organisms that can lead to impacts on both populations and communities, for example, in fish and frogs. Also, pharmaceuticals in the environment can lead to imbalances in ecological functions, for example, the cycling of nutrients like nitrogen or phosphorus, and this can lead to disruptions in the ecosystem services. And of course, we need to highlight antimicrobial resistance, that is an issue of high concern worldwide, I would say, not only because of possible impacts in the environment, but also for human health. So here you can see a graphic that shows the number of millions of deaths. It's a forecast for the next 25 years. So this is the number of attributable and associated deaths related to antimicrobial resistance. So we have different. We already know that the pharmaceuticals are there in the environment, and they have an impact both in the environment and human health. And please next. So we have an approach here in UNEP, consider the whole life cycle and the different sectors involved in the life cycle, as I said. Here you can see in this complex network, I would say, all these arrows connecting the different pathways that can lead to pharmaceutical movement from one sector to other and even to the environment. So here wastewater plays a key role in terms of being a source of release of pharmaceuticals, not only from household, but also from healthcare facilities, pharmaceutical industry, livestock and aquaculture facilities. So we see it like, okay, it's complex. We need to address with all the complexity, but also we have different sectors that could help us to tackle this issue of pharmaceuticals in the environment. So I will finish here. So that's all for the moment, and thank you for the opportunity to talk. And yes, or from my side, over to you, Nada.
Thank you very much, Gaston. Next, we'll turn to Kate Medlicott, Team Lead for Sanitation and Wastewater at the World Health Organization. Kate will present a summary of the recent WHO guidance on safe manufacturing and disposal of pharmaceutical waste. Kate, the floor is yours.
Thank you, Nada. Yeah, so just to say, I'm going to zoom in now on one part of this pharmaceutical life cycle that was presented by Gaston. And just to say that WHO works on this within the context of the Global Action Plan on Antimicrobial Resistance and our contributions to chemicals management within the health sector and beyond. So if you follow this link, you will find the guidance that we published last year. And next slide. In fact, it's part of two recent publications at different parts of this life cycle of pharmaceuticals. So one right at the beginning, the manufacturing end, and the other at the other end of the life cycle, safe disposal of unused medicines. The safe disposal of unused medicines was in a previous webinar, so I'll focus on the manufacturing one now. Next slide. So just to say, some people would say, oh, well, why the focus on manufacturing? It's a small amount of wastewater. What's the big deal when pharmaceuticals are so important? The reason we're focusing here is particularly because these manufacturing discharges can be very high concentrations and have a high potential for forcing emergence of new resistance, and also because this is a largely unregulated area that we can make real progress on. It's been called for by a whole range of international bodies as something that needs to be included in the manufacturing life cycle, and there was a genuine need for some really independent scientific advice on this to guide industry efforts. We get quite a lot of feedback saying, oh, we need to make sure that this does not harm access to essential medicines that are really important for fighting infections and disease. And as a result of that, there's a very clear stepwise phased-in approach within the guidance to make sure that we can make progress on reducing these harmful discharges and also maintain essential access to antibiotics. Next slide. So in terms of the scope, this is just antibiotics. There's a whole range of pharmaceuticals, but this one is covering antibiotics as a start, covers all steps of the manufacturing chain. There's a strong focus on liquid effluent, but also some on solid waste. And it includes both targets for emergence of AMR, so public health endpoint, as well as ecotoxicological effects. And you can see some of the things that are outside of the scope. Next slide. So really, if you want to understand what's in this document in a sort of a snapshot, it's really all on this slide. The conceptual framework has three clear roles with different target audiences to implement them to make sure we have a robust system of setting targets. So what is the health limit we're trying to achieve that will prevent the emergence of AMR? How do we implement risk management in the manufacturing process to make sure those limits are met? And how do we verify that those, independently verify that those are met? So these three components of setting targets, implementing the changes to meet them, and verifying that that's happened. Next slide. So in terms of the targets that are in there are targets based on effluent water quality. So those are expressed as PNEC for resistant selection and PNEC Eco for ecotoxicological effects. It considers zero liquid discharge, where it's not strictly zero liquid discharge. It would be treated the same as any other effluent released to water or land. And there is kind of minimum technology standards that cover the solid waste and the resistant bacteria in the liquid effluent. Next slide. Now, when it comes specifically to the liquid effluent itself, could you just click through the animation here? Yeah. What you'll see in the annex of the guidelines is PNEC values for 125 different antibiotics. There is methods for both chemical analysis or mass balance, which has been used by the Industry Alliance. There's some clear guidance on dilution factors. So how do you look at what's coming out of the manufacturing facility and how that is diluted in the receiving waters? And it has clarity about what is the site of the for the treatment and sample collection. Next slide. So in terms of ways forward, and this is really where we're at now, we've got to getting this guidance taken up by the various target audiences. And of course, we're looking to work with regulatory bodies and their associations. So for example, RAGNA, which is the Association for Regulators for AMR, We need to be particularly working with procurers, so those are retail entities, hospitals, regional bodies, and so forth, and including WHO's own procurement processes, the substitution schemes, inspection schemes, and auditors, including the industries-led one and WHO's own GMP, industrial actors, and of course investors in the pharmaceutical sector that can all be driving progress on this topic. Next slide. So I thank you very much. There's the link there. I realize I've used all my time, so I'll stop there and hand back to you, Nada.
Thank you very much, Kate, for very valuable insight on this important guidance. Now we'll move into the next segment featuring short expert presentation from different sectors and region. Our first presenter is Professor Yunjang Zhang, Vice Director, International Office, Professor, School of Environment Science and Engineer at Nanjing Tech University in China, who will discuss removal of pharmaceutical in wastewater treatment plants. Professor Zhang, over to you.
Thank you. Can you hear me?
Yes.
Thank you. It's very glad to be involved in this very interesting event. So my name is Yongjun Zhang, and Zhang is a very popular family name in China, one of the largest family name. And now I'm working in Nanjing Tech University in the city called Nanjing in China. I would like to share with you about the removal of pharmaceuticals in wastewater treatment plants. And I have been working on this topic for more than 10 years since my PhD time. Please go next. Yes, as the previous speakers has pointed out, so we use a lot of pharmaceuticals in the society. It's for sure it's very helpful to our health, but the problem is those pharmaceuticals we take in, it's not gone, so it's transferred in our body, and finally those pharmaceuticals and the metabolites will be excreted with you run our feces. When there's a sewage system, the pharmaceuticals and their transformation products will go to the wastewater treatment plant. And therefore, wastewater treatment plant is a very important barrier for us to control, to prevent pharmaceuticals and their transformation products getting into the natural water bodies. On this chart, you can see some of the pharmaceuticals can be removed very well, more than 50% or even over 80%, but some of them has been removed with a very low efficiency. Some even get negative removal. That means their concentrations increase somehow. So this phenomenon might be because the breakdown of some conjugates of the pharmaceuticals. And finally, if we analyze the concentration of pharmaceuticals in the effluent, and people can clearly see there's a high risk. So we calculate the concentration and the possible effective concentration of those pharmaceuticals on microbiologies. We can see some of them are quite high, and therefore it's very important for us to control the pharmaceuticals. So let's briefly check all the pharmaceuticals removed in wastewater treatment plant. Please go to the next slides. Yes, this is a very simplified scheme of most wastewater treatment plants. You can see on the picture, you can see some a large rectangular tank and some round tanks. So they are primary clarifier and secondary clarifier. The function of this clarifier is to separate solid in the wastewater. And the key part of the wastewater treatment plant is, we call it active sludge. And if we check details of the wastewater, please click, and we can see the sludge. It's like, okay, quite dirty water, but in this slide, they are full of microorganisms. And those microorganisms, that's key to degrade pharmaceuticals and other pollutants. But unfortunately, some of the pharmaceuticals are very difficult to be biodegraded. One click, please. So on this slide, you can see we use the biodegradation kinetics model to estimate is the pharmaceutical, is it biodegradable or non-biodegradable at all? So there's a red line. When the constant is below 0.1, we can see this pharmaceutical is hardly biodegradable because the overall removal in the wastewater treatment plant is very low. And for sure, some of the pharmaceuticals has been removed quite good. And there's another factor to remove the pharmaceuticals. We call it adsorption. So the pharmaceuticals are transferred from water phase to the sludge. But this removal is not the final answer. So because the sludge has to be further treated, and a lot of scientists has analyzed the concentration of pharmaceuticals on the sludge. On the next chart, we can see the concentration of pharmaceuticals on sludge. Please click. Yes, here we can see a lot of pharmaceuticals in the sludge phase. And I know in some places, this sludge is directly applied as some kind of fertilizer in the farmland. And in this way, the pharmaceuticals on the sludge will go to the nature. So if the sludge is incinerated, then that's good. So we can incinerate the pharmaceuticals. One more click. And another important fact is when we said biodegradation or when we said removal in the wastewater treatment plant, actually we cannot completely destroy the molecules. On this slide, you can see many chemical structures. So for the non-experts, you need to know when we said removal or elimination, that means in most cases that only means we transferred from one chemical to another chemical. Or you can say new contaminant is formed. Therefore, in the wastewater treatment plant, we must be very careful not only on the target contaminants, but also on the transformation products. Please go next. Now, what is the best way to prevent the pharmaceuticals from releasing with wastewater treatment plant is to upgrade the current wastewater treatment plant with a tertiary treatment step. And there are quite many technologies like advanced oxidation. So in this process, we can produce strongly oxidative species like OH radical. And we can also use membrane to separate the pharmaceuticals with clean water, nanofiltration, or reverse osmosis. We can also use constructed wetland. But most feasible or highly applicable technologies active carbon or ozonation. So there's already many full-scale applications with these two technologies in Europe and in China, and I know also some plants maybe in America. Please go next. Yes, so ozonation can be used at the full scale, and the cost is okay. It can be easily upscaled, but another problem is this technology will produce some byproducts, like I said before, with the microbiology process. This ozonation process also transferred the chemicals from one firm to another firm. And sometimes we may even have a high toxic byproducts, which is more toxic than the original forms. And when there's a bromate, we can also produce a lot of carcinogenic bromide byproducts. So that is another point we should treat carefully. Go next, please. And in China also made its own national plan to control pharmaceuticals and other emerging contaminants. In China, we call them new pollutants because it's quite different with the conventional contaminations. And the national plan has been released in 2022. And after that, many province has set the original plan to control the pharmaceuticals. And there's a short list of the priority new pollutants, including PFOS, antibiotics, and some other industrial additives. In China, industrial wastewater has been set up as a demonstration of removal technologies, like Kate just said before. So the antibiotic manufacturing wastewater contain a high concentration of antibiotics, and at that location, it might be advantage to remove them because the concentration is high and our input of energy or consumables is much less. In China, we have a similar situation. We have a lot of industrial zones or industrial park where a certain type of industry is somehow concentrated. And in this region, normally we have a centralized wastewater treatment plant, and that's also a good chance to demonstrate new technologies. As I know, in the province of Jiangsu, as an example, because this province is one of the largest chemical producer in China, also probably around the world. And almost all of the chemical park has installed the tertiary treatment step like ozonation or active carbon. Please go next. And finally, I would like to call for some further acts because control of pharmaceuticals is not a regional, it's not a local problem because those pollutants can be transferred through trade, for example, and pharmaceuticals we know has a very long production chain, and it will consist of tons of production steps. So in the synthesized process, we need to use a lot of intermediates, and during the process, a lot of intermediates may be imported from different countries. Therefore, we need to work together to design the green chemicals or to develop effective technologies. And it is very important to pay attention to the affordable techniques, which is especially important for the developing region. For example, ozone or active carbon is working very well, but the cost is still too high. At the moment, we have all of the technology tools which can purify the wastewater to a very high standard. The key challenge is the cost. And to develop cost-effective technologies, we need working together. We need to cooperate. And with these cost-effective techniques, we can support the water equity. And in this case, I think UNEP can play a key role to coordinate the global cooperation. For example, to show the control strategies developed by each country and to share the know-how, to share the knowledge, even to help the less developed region to build their own solution. And there's also other specialist organizations like International Water Association, like Norman Network, and it's also very good to work with them together. Yeah, that's what I want to share in this short time. Thank you again for your attention and for having me on this very interesting event. Thank you.
Many thanks, Professor Zhang, for this interesting presentation. Thank you very much. Now moving from China to Spain. Our second speaker is Dr. Sara Rodriguez, research scientist from Spain. She will speak about pharmaceuticals in reclaimed water used for irrigation of edible crops in the Mediterranean area, a crucial topic as water reuse become more common in agriculture. Sara, the floor is yours.
Thank you very much. Can you hear me well?
Yes.
I guess so. Okay. So yeah, thank you very much for the invitation. I'm very happy to share with you my views and my experience, and I will give you some examples that we are working on related to the topic. And of course, yeah, just to acknowledge all the team, all the people involved in the work that I'm going to present, and different projects too. So next slide, please. Yeah, a bit of context here. So yeah, water scarcity and water reuse. So as you know, the water scarcity has become a challenging issue, especially in arid and semi-arid regions, as for example, at the Mediterranean area, as you can see in the map. And so it's affecting to many countries and many areas. And agriculture is one of the sectors more affected for this water scarcity. In this context, the water reuse, the reuse of wastewater for agricultural purposes, for irrigation, offers a lot of opportunities, but also a lot of challenges. So some ideas here about water treatment needed, because we cannot apply directly, even if it's treated wastewater, like from the secondary treatment, we still need to purify the water further so that we can apply into the fields. And in that sense, there are several options that were mentioned actually by the previous speaker. Some examples I put here, like ozonation, UV treatment, advanced oxidation processes, nature-based solutions offer a lot of advantages too, and also the coupling of different technologies, having in mind also the costs of this treatment, and also the treatment of the wastewater inside what is called the centralized water treatment systems, is always to have in mind that we need to assess the risks for the environment of these practices and also for human health, and to pay attention to micropollutants, including pharmaceuticals. So basically, in the right side of the slide, so we have to pay attention to pathogens, other contaminants, nutrients, metals, and organic pollutants. And among the organic pollutants, yes, a bit of animation, please. Including another click, please. Pharmaceuticals and wastewater derived contaminants. Next slide, please. Yeah, a bit of context about water scarcity and water reuse regulation. First, that water reuse can be, the wastewater can be used for many purposes, for industrial applications, for recreational, for maintaining the environmental status. There are different scenarios where this wastewater can be reused, and I'm going to focus on the irrigation of crops, as I mentioned. Some animation, please. Click. Yeah, and just to say that in Europe, we have a recent, about 5 years old already, regulation on water reuse, which is regulated the use of wastewater for this context, for agricultural context. And next, Yes, and I'm going to focus on edible crops in this presentation. Yeah, just to say that, yeah, we have this regulation in Europe, but in Spain, we have been pioneers with other countries because we have been using wastewater for irrigation for longer years. So we have like another internal or national regulation very aligned with the European regulation. Next slide, please. Yeah. So in this context, I will explain a couple of examples of work that we have developed in the Catalonia and also in Greece. You can go on with the animation, please, with the whole, yeah, and yeah, thank you. So I will present some studies that we have done in Spain, lab studies, theoretical studies, and in Greek islands we carry out some field studies too. Next slide, please. This is the example of the field experiment study that we performed in Lesbos in Greece. So basically, we had these facilities here where the effluent, the raw wastewater from a town in the Lesbos island was treated with an anaerobic treatment, the USB, as you can see, and then there was coupled to a wetland system, the constructed wetland series, and then to generate an irrigation water that was applied to the crop fields that are not shown in the picture but are where the agro system is indicated. Next click. Yeah, and these samples from water, from the soil, and from the vegetables were shipped to our facilities in Girona in dedicated extraction to extract the pharmaceuticals, because this is what we were studying. Next slide, please, with these methodologies applied. Next slide, please. Yeah, you can go on with the animation, please, a bit further, just to see the whole, yeah, just to explain about the soils that are very important to be monitored because are the first receptors of contaminants, in this case pharmaceuticals. And we were taking the samples in 2 seasons, fall and summer, to track some differences. And we were also taking samples from the bulk soil, but also from this soil around the roots, what is called the rhizosphere soil, but also the rhizoplane, which is the kind of the biofilm attached to the roots. So we were taking these separate samples to analyze. Next slide, please. And a bit further, please. Yeah. So, and also the crops. In this case, we analyze basically lettuce and tomatoes, but I'm focused here on lettuce, and we wanted to differentiate what is taken up by the contaminants are taken up by the roots and the leaves. So we were extracted and analyzed separately. So next slide, please. Yeah. So yeah, you can go further because there is a lot of animation. Yeah. So yeah, we'll leave it like that. So just for you to show, I mean, there is all the pharmaceuticals that we were analyzing in the column on the left, and in the 2 seasons, and just to show you how the water concentration, the water levels of these pharmaceuticals in the blue color were quite aligned with what we found in the bulk soil and the rhizosphere soil and then the rhizoplane. So that happened in both seasons, more in summer when we found more concentration of these compounds, and also we found kind of I would say concentration, or that the compounds were more concentrated near the roots in the rhizoplane. This is one of the findings of this study on the field. Next slide, please. Yes, a bit further to have the whole picture. Yeah, thank you. So, and by tracking the contaminants along the water, the soil, now the lettuce, we saw not so many compounds bioaccumulated in the plants, but some were accumulated, as you can see here in the figure. And it happened that some of the compounds stick to the roots or stay in the roots, but some of the contaminants were reaching the leaves, which are the edible part of the plant, which is important for human health purposes. Next slide, please. And now I move to some experiments that we were performing also at the lab, just to show you that sometimes we have some observation in the field, but if we want to explore further some contaminants in particular, so we need to have control conditions. This is what we did at our facilities. We were planting these lettuces in the hydroponic system, where we were exposing these lettuces to high concentrations of psychiatric drug, and also its metabolite, which is the oldest methylvenlafaxine. So next slide, please. And we were collecting all the samples, and here I want to show you some of the findings, just briefly, just to basically to show you that two very similar compounds, the venlafaxine, but also the metabolite, which is also very important, as it was mentioned previously, they had different bioaccumulation in the plants. In both cases, in this case, roots accumulated more than shoots. Shoots is the aerial part of the plant, because of the different physicochemical characteristics of these compounds. Next animation, please. And also, it was interesting also to analyze the metabolites, okay? Because the metabolites of venlafaxine, which is the psychiatric drug, but this methylvenlafaxine is a metabolite, but also other minor metabolites were also tracked in the samples, and with much less concentration over there, but we have to pay attention to those side contaminants, I would say. Next slide, please. Yeah, we can leave it like that. But basically, this is the theoretical approach. What we did in this case, we wanted to see which are the contaminants in this case pharmaceuticals, which are the most relevant in a scenario of water reuse for irrigation. So, but we counted on the data in water from the publications that we have been generating in the last decade in our institute, where we were intensively studying the pharmaceutical occurrence in the environment. So we were collecting and building a database with about 30 publications during this decade in Catalonia, in the region, with about 150 pharmaceuticals and metabolites that we were analyzing. We put that all together, and by taking this data from effluent wastewater, we started to develop and to prioritize which are the contaminants that we find in the effluent wastewaters in Catalonia, which are the ones which are relevant for the ecosystem and for human health. So we will perform this theoretical prioritization. Basically, in the first step in the blue box, we apply that environmental risk assessment based on the OPBT criteria, which is occurrence, persistence, bioaccumulation ability or capacity, and toxicity. And we were putting some scores to these compounds. So we filtered the 150 to, I don't remember now, I think it was 70 compounds that were relevant based on this score. And then we got further, and in the brown box, we apply also risk assessment, classical risk assessment, to assess what is the risk of these contaminants, for what could be the risk for the contaminants in the soil, for the terrestrial environment. And we also perform this approach for human consumption, basically to predict what would be the uptake of these prioritize compounds in the plants based on the physicochemical properties of these compounds, and also collecting information from the literature. And we perform a human health risk assessment based on this MEC crops is the measured environmental concentration, what we found in the plants, in the literature, and that value with what is considered the accepted daily intake for human consumption without posing a risk for the health. So, and based on that, we ended up with a set of compounds that might be of risk or not for the ecosystem. Next slide, please. Yeah. For instance, in the case of the risks for the soil environment, as I mentioned, we were investigating lettuce crops and tomato crops, but since lettuce requires more water, that therefore also maybe more exposure to these contaminants. So yeah, so we found that based on the risk quotient, some like 6 compounds might pose a risk for the terrestrial ecosystem, including 3 antibiotics highlighted in red. And next slide, please. Whereas for human health, these compounds here, the carbamazepine, fluoxetine, venlafaxine, and this metabolite of carbamazepine, considering the consumption. I mean, what we were calculating here is to make it easy to understand, no, for not scientific audience, is to the amount of, in this case, lettuce and tomato that we have to eat in order to reach these dangerous levels, I would say, the accepted daily intake, basically. And we saw that to achieve certain, to cause a problem for the human health, we should eat, almost a kilogram of lettuce every day, more than a kilogram of tomatoes every day. So that supports the idea that in principle these practices are not posing a risk for the human health. And with that, say that I'm finalizing my presentation. Next slide, please. Yeah. So thank you.
Many thanks, Sarah, for very valuable insight and nice talk. And we are moving now to India. Next, we'll hear from Dr. Rajeshwari Sinha, Senior Program Manager, Center for Science and Environment, India. Dr. Sinha will address how the issue of antibiotic manufacturing waste can be effectively managed, particularly in industrial context. Dr. Sinha, please go ahead.
Yeah, thank you, Nada. You can hear me, right? You can hear me well?
Yes.
Yeah. So, so I do not have slides, and I will probably speak for the next couple of minutes. Firstly, thank you for having us on board this webinar, and a couple of interesting discussions that happened, trying to understand the effect of pharmaceuticals in wastewater on the wastewater treatment plant, and then on agricultural soil and crops. And then my perspective to this discussion will add on how does antibiotic manufacturing wastewater impact the environment, particularly in the context of the issue of antimicrobial resistance, which I am hoping that this audience will understand that is a global public health problem today. And globally, there is an understanding that the issue of antimicrobial resistance is a One Health problem, which has multiple sources. And antibiotic manufacturing is often considered as one of the important sources contributing to residual antibiotics going into the environment through the wastewater. In addition to many other sources from the human side, from the animal side, or even for the crop irrigation side. And over the last few years, this issue of antibiotic manufacturing leading to antibiotics in wastewater has got momentum. There has been discussions, couple of interesting reports The very important report that UNEP came up with in 2023 was Bracing for Superbugs, and which recognized as pharmaceutical manufacturing as one of the key economic sectors contributing to the environmental dimension of AMR. There is this very important collaboration report between WHO and UNEP, which was put out last year, which talked about, it's a global guidance on how to go about managing antibiotic manufacturing waste as well as wastewater in the context of reducing AMR. The Global Leaders Group on Antimicrobial Resistance, which is like an apex group that oversees the operations of the quadripartite and helps guide manage the global AMR fight, also came out with a call to action earlier on how discharge from the manufacturing sector can be managed in the context of antibiotic residues. But most importantly is the political declaration on AMR, which was adopted last year, September 2024, and it talked about the need to address antimicrobial discharge into the environment in view of the problem we have in hand. And with this background that I said, I'm going to spend the next couple of minutes sharing our experiences based on the work that we have been doing here at CSE. Over the last few years, we have got the opportunity to work with stakeholders, pertinent stakeholders, for example, the pollution control regulators, the industry, antibiotic manufacturers to be specific, small and large manufacturers, waste management players, civil society, scientific and academic community. So we have been able to touch base and understand the perspectives of each of these stakeholders as somebody which is not a representative of the government, which is not an industry. We as a civil society play the role of a watchdog to understand what is being done or what can be done and help inform the stakeholders about possible solutions or to help trigger discussions on the issue and see how we move forward. So first and foremost, pharmaceutical manufacturing, particularly antibiotic manufacturing, is relevant for India because India is not only a big producer but also a key exporter, and it has a big role in the global supply chain. There are big companies which are operating out of India, which are not only capable and have the resources to be able to manage their waste quite well, and also to add that there is gradually a growing demand for procurement of sustainably produced, not just pharmaceuticals, specifically antibiotics. And so when we got together over the last couple of years and brought together industry, regulators, scientific community, civil society, it was kind of an eye-opening for us because the discussions that came up were really beyond what we typically talk about, what we typically think is going to come out. First and foremost, there was a recognition to the problem. There was an acceptance to the problem, which indicated that now there is growing awareness among stakeholders about the issue of AMR, the science behind it, the linkage of antibiotic manufacturing to the AMR problem, and also the need for greater awareness and capacity building in this direction. There is less denial and greater acceptance to the problem. And also to add to that, there is keenness to address the issue, not just individually, but also the keenness to work together as a unit to come together and address this problem. But also be careful that while we address the problem, we also understand that addressing this problem is in our own interest, from the public health point of view, from protecting the environment point of view, and also from the trade point of view. But also be careful that when we work towards solutions, we see that the solutions are localized, the solutions are cost effective, and the solutions are something which we are able to afford. Also bearing in mind that whatever measures that are being taken does not affect the industry, does not affect the business, does not affect the access to antibiotics and also the supply chain. So these were the various points that the industry and the regulators deliberated and put forward that yes, we recognize the problem. There is an issue. We want to work towards it, but we have to be slow. We need to look for solutions that work for us as somebody who are located in the global south. We should have our own solutions, which are affordable and cost effective. There is also a point that there has been a global discussion on whether we should have discharge limits. Let me also put it up front that globally there are no discharge limits in the context of residual antibiotics in pharmaceutical manufacturing effluent. But there has been discussion whenever we talk in platforms, this topic automatically comes. But when we engaged with this group of stakeholders, what we understood was being able to manage antibiotic manufacturing waste is beyond just the standards, beyond just the issue of having discharge limits. It is first and foremost having the right way of effectively managing the waste that is being generated. It is about adoption of preventive measures, which was also somewhere reiterated in the earlier presentations, in the earlier discussions, that if we are able to manage what we are putting into the environment, I think there is less need to worry, because then what is coming out of the environment is automatically will be taken care of. And to put some specifics into what I mean by prevention in this context, it's about having the right process control measures. It's about having the right kind of advanced technologies, which may be at the end of pipe, which may be in between the process. There are certain advanced technologies which the industry here is adopting, but at the same time, they could be customized. Industry needs to have the right amount of resources to be able to invest in these kind of advanced technologies, because they don't come at a lower cost. And then there is a group of small scale industries for which there is a need for extending support, for extending handholding through awareness, capacity building, infrastructure support, through the development of low cost, affordable technologies as well. Technologies has definitely come up as a solution, and towards which the scientific community and the academia are also coming forward and joining hands with the industry to see what can be done. Of course, coming back to the issue of discharge limits, there is no denying the fact that this point is important, and having this regulatory backing to whatever we are saying, the management of pharmaceutical manufacturing or antibiotic manufacturing waste, having this regulatory backing is definitely important. But as a low and middle income country, as a country of the global south, we also should understand what are the industry concerns. And what we have understood is that they are not saying that we should not have standards, but what they are saying is we should have standards which have to be phased, which have to be incremental, taking into serious consideration our local consequences, our local realities, and also not going gung-ho right into it, but making it more incremental and more phased. Also, not just having policy, but if we are implementing policy, we will need to monitor it going forward, whether the implementation is working, whether it has at all worked, what kind of modification that implementation needs to be effective. And for that monitoring, we need to have the right labs, we need to have the right infrastructure. The labs have to be equipped in a way which are able to monitor antibiotics. Again, it cannot become a routine process, because then it is going to add onto a lot of resource burden on the lab. So there has to be a definite mechanism of monitoring and data and transparency, and a lot of layers coming into it. The industry is also segregated into large, medium, and small players. And then we have, particularly in India, we have this concept of common effluent treatment plants, which largely cater to the small and medium players. So we have to see how we go about it, and not just put forward and say that we need to have discharge limits. So there are nuances which need to be taken care of. Also, having said this, I'm almost towards the closing of my intervention. I think what also came out is, as a civil society, through this exercise of engaging with the industry as well as regulators and other key stakeholders, we have also been able to inform them about the global direction of where this issue is going, where globally the science is going, where globally the policy is going, and how this can be taken into consideration while looking for solutions. We also think that it is important to be able to inform policymakers rightly, and informing policymaker does not just mean informing about whether we should have standards or discharge limits or not. It could be about any waste management guideline which is able to help manage the waste effectively. Overall, our interaction has been very positive. We get a very positive energy, we get a very positive vibe from the stakeholders, particularly in the context of wanting to work together to address the problem, but also being cognizant of their concerns, being cognizant of the business, and also looking for solutions which are low cost as well as effective, as somebody located in the global south. I'd like to stop there. Thank you.
Many thanks, Dr. Sinha, for very wonderful reflection on the global and the national perspective to address IMR antimicrobials. We welcome Dr. Olfa Mahjoub, Associate Professor, National Research Institute for Rural Engineering, Water and Forestry, University of Carthage, Tunisia. She will discuss pharmaceutical compound and water reuse in agriculture and the critical question, to irrigate or not to irrigate. Dr. Olfa, over to you.
Hello, good afternoon, everyone. Can you hear me? Can you hear me well?
Yes, go ahead.
Okay, great. Well, thank you very much for having me. I'm really glad to contribute to this webinar and also to give an insight on research carried out in Tunisia, and also to shed light on the reuse for agriculture irrigation through this question. Actually, this question has been asked to me every time I start talking about emerging contaminant in general. And I think it's very crucial to the farmers and also to the stakeholders in general. So next slide, please. Yeah, so you can recognize that Tunisia is like many water-stressed countries. We are in need of alternative water resources to ensure water and food security, especially that by the year 2050 we'll be suffering water stress, as you can see here on the map. And actually, Tunisia is producing around 300 million cubic meter per year of treated wastewater. And when I say treated wastewater, it's a secondary mainly. So this treated wastewater is used for irrigation at a rate of 7% to 10% almost in agriculture. And this wastewater is actually a source of water and nutrients. So we need to take benefit of this resource. But unfortunately, as it has been mentioned, the treated wastewater is not only the source, but it's also the sink of these pharmaceuticals. And although in Tunisia we had this national strategy for wastewater reuse, so we may have to ask questions about the safety of the wastewater and also the safety of the crops irrigated with treated wastewater. Next, please. So in order to address this question, we started working on this topic, and actually we were pioneering the MENA country in terms of scientific research and as an agricultural research institute. And we launched several, the very first project, it was in the early 2000s, and we have been working on the carbamazepine and its metabolite, which is an anti-epileptic, a persistent one that is not removed by a secondary treatment. And also we had our first project on emerging contaminant in general, and this has gathered several stakeholders and also civil society. So we have been reaching a large span of large categories of stakeholders, but also academia. Besides that, we have been observing that there is an increasing number of publications in Tunisia on pharmaceutical and treated wastewater, and they are covering different topics. And but we realized that there are very limited studies with practical implication on the policy, on the water policy, and also on the regulatory framework. Next, please. Yes, so here I will go back to the cradle, let's say, of the research on wastewater reuse in Tunisia. It was, this area is located in the northeast, as you can see here on the map. It is where we started working on the wastewater reuse, and this has contributed to setting the current a national standard for reuse, actually. But in this area, there was a very specific problem related to the availability of the water resources. So since the groundwater there is saline, and the farmers, they have no alternative water resources, so the treated wastewater was the unique resource to save the agricultural activity, but also to secure food and water at the same time. So the farmer, they claim the reuse of wastewater, and this is to highlight the acceptability of the reuse in this area. So you can see here that the water, the treated wastewater, is coming from 2 treatment plants, providing secondary treatment, and the water goes to the storage basin, and then it goes to be distributed to the farmers. And on the picture, you can see also the kind of irrigation they are practicing. This is mostly furrow irrigation, so you can figure out the amount of water that is brought to the soil, that is spread and could infiltrate to the groundwater. So since this area is receiving treated wastewater since more than 40 years, you can figure out the impacts on the groundwater, but also on the soil. Next, please. Yes, so this is among the first research that we have been carried out to get in partnership with some colleagues. So the first study covered 25 pharmaceutical and in addition to personal care products, and also some even some industrial compounds. And we realized, you can see on the figure on the left, that we found the sulfamethoxazole, for instance, and the carbamazepine. Sulfamethoxazole is an antibiotic, carbamazepine is the anti-epileptic, and you can notice the level of concentration in the secondary treated wastewater. And on the right, you can see the storage basin, which is collecting the water from the 2 treatment plants, and you can see the level of concentration. So they are quite comparable, even though the concentration are a bit lower. So here you can figure out, what are the compounds that are transferred to as an irrigation water to the field. Yeah, next, please. Yes, so as I mentioned before, the farmers are practicing furrow irrigation. So there is a high amount of treated wastewater that is brought to the soil. So we have been analyzing groundwater. Here you can see the well, AA, etc. These are farm wells. So the farmers there are using the treated wastewater for irrigation. For the experimental units, these are wells where we are reusing to carry out research in our experimental area. And the control well, it is supposed to be free of contaminants, though it's located in the upstream of the irrigated area of Wad Suhail. However, you can notice that we found sulfamethoxazole, which is the antibiotics, and carbamazepine, the anti-epileptic, in some wells, but also in the in the control well. So this means that this control well is getting pharmaceuticals from an additional source. Maybe it's not wastewater, but there is another source that could be manure, for instance. And it has been proven that manure could be as a source of antibiotics and also of pharmaceuticals. But also you may notice that triclosan, which is widely used, it was detected in all the samples, in all the groundwater. So you can here notice the concentrations first of the different compounds, but also the contamination of the groundwater in this area. Next, please. So more recently, we have been working still on this area, but we have been collecting water from other wells. You can see here on the top, close to the storage basin, and in the middle of the irrigated area, surrounded in yellow. And we noticed in this area that the farmers are combining groundwater and treated wastewater for irrigation, because sometimes there is an interruption of the wastewater supply. So the farmers, in order to guarantee the adequate amount of water for their crops, so they start mixing the water. So they are conjunctively using treated wastewater and groundwater in order to guarantee the the amount, but also sometimes its practices in order to improve the quality. Even visually, when they see the water is turbid, they may add groundwater to make it clear, and this will be a kind of guarantee that the quality of the water is somehow adequate. But if you look at the table on the left, you can see that we have found more antibiotics like ofloxacin at a relatively high concentration, not only in the treated wastewater and in the storage basin, but also in the 2 wells and the one located in the upstream. And also we have been detecting more antibiotics and other compounds here. Next, please. Yes, so in addition to the groundwater and the treated wastewater, we have been analyzing the soil in another plot, which was growing fodder, maize fodder for livestock. And here we have noticed that on the top of the soil at 10 centimeters, we found the carbamazepine again and sulfamethoxazole. But also we noticed the presence of trimethoprim, which is used in association with sulfamethoxazole. And it's widely used in Tunisia. And you can notice also that during irrigation, the concentration is around 2, and then the concentration has increased even 1 month after tillage. So it means that there is another source of this antibiotics in this environment. And by the way, we asked the farmer, what kind of practices does he have on this plot? And he declared that sometimes he brings some animals for grazing. So we thought that this could be an explanation. So here you can notice the importance of farmer practices in the spread of antibiotics and pharmaceuticals in general. And on the right, you can notice also the analysis of the maize forage, where we found a concentration of trimethoprim. And this was during the growing season, but also after the harvest. And this would trigger the question about the risk for animal health. And as previous colleagues have mentioned, though, we need more data in order to confirm the risk for the animal health as well. There should be an animation. Yes. So here, and according to the literature, and it has been proven that a potential transfer of antibiotic-resistant bacteria could occur. Actually, the E. coli could be resistant, and this was found in some ovine and poultry isolates from manure. And by the way, ovine manure is used intensively in this area. Next, please. Yes, so here to conclude, so to irrigate or not to irrigate, we would have a different argument to justify this. Yes. So we should irrigate because it's about water and food security in this area. So if the farmer do not irrigate, they will risk their agricultural activity. This will harm their income, etc. So this is an argument to go for. But also there is a risk for human and animal health. So there should be other arguments, and we should take into consideration both arguments. So at the end of the day, there is no right or wrong answer. There should be something in the middle, and we should manage the risk in the appropriate way. And so it's not about the pharmaceutical by themselves, it's about the practices, about the behavior on which we should focus in order to prevent any kind of dissemination of these pharmaceuticals in the agriculture area. Also, there should be a risk-based approach. As Sarah have mentioned previously, this is very important, but this requires a lot of data. So we have to work collaboratively in providing reliable data. And science-based policy making is very important because up to now, and according to some studies that we have been carried out, some stakeholders and even policymakers, they do have very few elements on the emerging contaminant in the environment. And to conclude, yes, the development of treatment technology. So currently we are, and more particularly today, we are kicking off a project on the use of constructed wetland for the removal of antibiotic-resistant bacteria, genes, and also antibiotics. And probably we will keep you updated about this, the outcomes of this project. Next, please. So I would like to thank my colleagues Despo Fatakasinos, Elke Fries, Aurélie Moffret, and Caroline Michel, and also Serge Chiron for their collaboration. And this is to underline that it's very important to collaborate and to cooperate with different institutions. Thank you.
Thank you so much, Dr. Olfa, highlighting the very important topic. And thank you all to all our speakers for those rich and thought insights. We heard about the science, policy implication, and technical practical challenges across sectors, from wastewater treatment plants to agriculture use and manufacturing processes. Before we move into the panel discussion, we'd like to hear from you, our audience. So we will launch 2 quick poll questions to capture your perspective, and please select up to 3 options for each question. We already have the first question in the Slido on the polls part. And the question is, which area offers the most promising opportunities to prevent and manage the release of pharmaceutical into the environment from wastewater? Yeah,
So shall we answer the question now?
Yes, please.
Or we're waiting? Okay. Yeah, my opinion is, should we?
If you can please just select up to 3 choices or option of these.
Yeah, my selection is highly dependent. So it's very hard to select which one is the top. It's the top choice. It depends on the background. It depends on the location where you are. And my idea is we need to work together. So if you are a chemist, please go to design a green pharmaceutical. And if you are a wastewater treatment engineer, you should try to develop a cost-effective technology. And if you are in the law or in the management sector, try to make some policies.
Professor Sam, I mean, from your perspective, just select, 3 of these choices, and everyone of the speakers and our audience will select, and then at the end we'll see the result and we'll move to the discussion part.
Okay, then I will select the first is wastewater treatment technology for my background. And secondly, I need to kick the ball to the problem source, green chemistry. Yeah, there's a green chemistry.
We'll see the result.
On another screen, or
Green
I saw the
chemistry.
green
Maybe
chemistry. Yeah, then the policy makers. If I select the top 3, that's my
Dr.
choice.
Sang, we will give a bit more time, maybe 5 minutes for people to choose this option. And then now we are moving to the discussion part with our speaker. We have some questions we need to discuss with you. Is that okay? So we will now hear reflection from our distinguished speaker, focusing on what is working, what remains challenging, and how we can move forward collaboratively. Actually, Dr. Sang, we have a question for you. Your presentation highlighted the complexity of pharmaceutical residue and their transformation product. From your perspective, what are the main challenges in addressing pharmaceutical release into the environment through wastewater? Professor Sang, we have a question to you.
Oh,
Can you
it's to
hear
me
us?
again. Yeah. I thought
Yes.
I already answered the question.
Yes, we will come back again to the pool question, but now we have a question to discuss. It says, from your perspective, what are the main challenges in addressing pharmaceutical residue into the environment through wastewater?
Yeah, as I said before, so I'm an engineer. My interest is in the control technology. But the challenge for us is two aspects. One is we need analyzers. We need simple analyzers, instruments or method to analyze the pharmaceuticals. You know, their concentration is very low. It's in nanogram per liter. And not all of the laboratories have the facilities to detect them. That's the key challenge. And secondly, we need to completely destroy the pharmaceutical, the target contaminants, not just transfer them from one firm to another firm. And we need to reduce the negative impact. That means toxicity. We need to remove the pharmaceutical and to remove the toxicity. That's the second challenge we have. And the third one is at low cost.
Thank you. Thank you very much, Professor Zhang. I will just ask kindly our speaker to have only 1 minute response, very concise response, because the time limit we have. I'm moving to Dr. Sarah. We have a question to you. Your work on reclaimed water has been particularly illuminating. How are a new analytic instrument and technique helping improve the monitoring and understanding pharmaceutical in the environment? Over to you.
Yeah, thank you. I will try to be brief. Yeah. With what we really need to development of new instrumentation is being like really triggering the research basically, and we in the last years we have witnessed all this evolution in the analytical methodologies, and this to highlight we haven't focused much on these analytical methods, but we are moving from the target analysis to non-target or suspect screening, where we can monitor a wide range of compounds and not limit to some few. But at the same time, it's important to focus on some priority compounds that we prioritize based on the case by case, in order to use these compounds as surrogate of the status of practice of the environment, etc., etc. Thank you.
Thank you very much, Dr. Sarah. Dr. Sinha, turning to you, you explore the industrial dimension, particularly antibiotic manufacturing. From your experience, what levers or practical tools are available to address pharmaceutical and wastewater, particularly from manufacturing sources? Over to you.
Yeah, thank you for the question. I would keep it very short and simple, and probably draw from the intervention I made. I think the levers are pretty straightforward. The most important lever is the stakeholder. It is the right stakeholder coming into action. That is what the most important, which I think. And then we have levers of awareness and capacity building. We have what is important is having policies in place, regulations in place. Another lever could be research and development of data and supporting evidences, bringing together what is happening currently, where we are moving forward. Another lever is surveillance, monitoring, having the right infrastructure to be able to help surveillance. Technology is another important lever. And I want to go back to this point of stakeholder, where again industry holds a very important place, and should think about an important lever within this is the adoption of preventive practices to be able to reduce the input into the environment as much as possible, and focus on technology and in-house capacity building and support policy. That's about it.
Thank you very much, Dr. Sinha. Dr. Orfa, in your opinion, what does it take to convince stakeholders to reuse wastewater for irrigation when there is reluctance due to concern about pharmaceutical residue, particularly where there are no alternative water sources? Over to you.
Yeah, thank you. Thank you for the question. Yeah, can you hear me? Yeah. Thank you very much. Actually, it's very important to raise this because I think the first thing to do is to explain to the users the sources of pharmaceuticals, and they should take into account that they are the main source, not only humans, but also animals and other industries. And by knowing this, I think they will have a responsible behavior. So they will consume the pharmaceutical very carefully, and they will give them to other animal also in a very reasonable way. Second, I think it's very important also, it depends on the usage of the wastewater. So if you are irrigating fruit trees, it's not like you are irrigating garden crops. So the fit for purpose treatment here is very important, and the farmers and the end user should be conscious about this. And I think finally, it's very important to have a multidisciplinary team that could address this, because a researcher alone cannot address it, but we need to involve the farmers and all the stakeholders in order to know exactly what kind of risk they are faced to if they have a bad behavior or they are misusing the pharmaceuticals. Thank you.
Thank you. Thank you very much, Dr. Alfa. Thank you all for this valuable perspective. Now, to close our session, I'd like to invite Ms. Poppy Carolia, Senior Wastewater Surveillance Expert from UNEP, to share some final reflection. Poppy, the floor is yours.
Thank you. Thank you, dear colleagues, and thank you for the very interesting webinar and very nice presentations today. So to close this webinar, I would like to start with the fact that we have made obvious pharmaceutical residues are a systemic issue, meaning that they enter the environment through the whole life cycle of these pharmaceuticals, starting from the manufacturing, their use in humans and animals, and their disposal, where they persist in wastewater, where they persist during agricultural reuse with various consequences which we largely do not know, including the proliferation of AMR. So we can say that wastewater is a critical cross-sectoral pathway which links healthcare, which links agriculture and ecosystems under a One Health framework. So regarding the treatment of wastewater, we can see that there are some end-of-pipe pressures. We have the conventional treatment, for example, the biological steps such as the conventional activated sludge, which have shown limited removal efficiency for certain compounds, for example, carbamazepine or diclofenac, as we have seen. The microbial consortia may play an important role within this treatment. However, the persistence and transformation of the parent compounds within these systems can generate new, sometimes more toxic contaminants within the wastewater treatment system. And to add to the complexity, the impact of pharmaceutical residues on the actual wastewater treatment steps remain unclear. So we have to consider aspects such as mixture toxicity, the transformation of pharmaceuticals during treatment, as well as various ecological interactions, which remain major scientific and regulatory gaps. Of course, we have different tertiary treatments, ozonation, activated carbon, membrane filtration steps, which improve removal. However, as we have seen, they're costly and sometimes energy intensive, posing additional challenges. Now, given the presented studies within this webinar and beyond, we have seen that pharmaceuticals can be transferred to soils, to crops, and also to groundwater. Their impacts on all these organisms found in receiving environments, due to their diverse sources, their complex mixtures and interactions, remain unknown. The variety of compounds within treated effluents, ranging from antibiotics to hormones to other chemicals from multiple origins, may lead to different effects, including synergistic or additive effects, as well as persistence, posing challenges across the treatment systems, as well as on environmental receptors. So what is important here? It's important to note that pharmaceuticals, even though we are concerned about them, they're still largely absent from wastewater discharge standards and reuse regulations, which typically focus on microbial and conventional pollutants. Therefore, fit-for-purpose treatments and risk-based reuse frameworks are important to minimize exposures, as well as maintain food and water security, and integrating with stakeholder awareness, with user practices, as well as science-based policy development and integration with AMR action plans are key. Now, key levers to advance progress in this topic include among others, education, raising of awareness among consumers, practitioners, policymakers, technological innovation and investment in such innovation. For example, low cost and combined treatment systems. We need policy coherence linking AMR, One Health wastewater management frameworks. And of course, we should not forget the extended producer responsibility, as well as different life cycle based interventions, so that the producer can account for their products. Other preventive and circular strategies include green pharmacy, which has been mentioned before, manufacturing standards for effluent control and end-of-pipe effluent optimization. And of course, UNEP's life cycle framework for upstream prevention and downstream mitigation should not be forgotten. And international cooperation and funding are always crucial. Finally, I would like to close with the fact that managing pharmaceuticals in wastewater is not the end of the story. It is a part of building sustainable health and water systems across the entire pharmaceutical life cycle. And UNEP stands ready to foster science, policy, and partnerships which are needed to make this transition. Thank you very much.
Thank you very much, Poppy, for the nice closing remark. And indeed, you mentioned awareness, public education, behavior change. And as we see in the poll question, is the highest percentage, 41% of the opportunities to prevent and manage the use of pharma. And also the second one, 35% is advancing wastewater treatment and removal technology. Can we see the challenge question? Yes, the highest percentage for the challenge, also the limited awareness and lack of prioritization among policy makers. The second one is limited access for affordable and advanced treatment technology. So the challenges of pharmaceutical residue in wastewater is not just an environmental issue, it's a mirror of how our health, ecosystem, and economy are interconnected. What we hear today reinforces the solution exists, from improved treatment technology, responsible manufacturing, to better monitoring, governance, and public awareness. But these solutions need to be scaled, connected, and supported by strong leadership and cooperation across sectors. Thank you once again to our speaker, partner, and participant for your engagement and commitment. Let's continue this dialogue beyond today and turn knowledge into collective action. Wishing you all a very good day or evening. Thank you.
Thank you very much, Dada. Let's move to Claudia to make some announcements for those who are still with us.
Thank you very much, and thank you to our panelists and attendees of today. So next week, the Geneva Environment Network and various partners will be hosting a series of online events ahead of the Minamata COP6. So we will have a session on strengthening the Minamata Convention and new approaches to global mercury trade and ASGM, one on the new science policy panel on chemicals, waste, and pollution, and one on the impact of mercury exposure on the rights of indigenous peoples and ways to address them. Next week, we will also be active in still this week, on Friday, we will be supporting WIPO and France at the Geneva launch of the Green Technology book, as part of a series of events celebrating the 10th anniversary of the Paris Agreement. And then next week, we will also be at the 5th session of the Forum on Human Rights, Democracy, and Rule of Law for an event on the global ethical stocktake ahead of COP30. And upcoming, we will also be present at the 16th session of the United Nations Conference on Trade and Development, UNCTAD 16, for an event on biodiversity-based economies. And still within the month of October, we will be hosting a briefing on the World Wildlife Conference, the 20th meeting of the Conference of the Parties to CITES, to take place in December in Uzbekistan. So we will be sharing a link in the chat for you to access all these events. And with this, I thank you all for being here and wishing to see you soon at our next events. Thank you.
Thank you. Bye-bye.
Thank you.